Depression, often defined as the disease of the soul, is one of the most common and invalidating psychic disorders. Depression is living in a body that fights to survive with a mind that tries to die. For many years, it was mistakenly described as a momentary state of sadness. Already in the 5th century BC, Hippocrates, ancient Greek doctor and aphorist, today considered the father of modern medicine, attributes depression to an excess of black bile. This is a concept that, according to Hippocratic physiology, was one of the 4 fundamental humors. Its prevalence over the other 3 humors, yellow bile, blood, and phlegma, would have determined a melancholic temperament. Today, instead, OMS defines depression as a disorder characterized by a persistent sadness and loss of interest in the activities usually pleasant, accompanied by a difficulty to perform the activities for at least 2 weeks per day. There are different forms of depressive, each characterized by specific symptoms, and each deserves specific treatment. However, there are some main symptoms that are typical of depressive disorders and can be classified in some categories. Which ones are they? Cognitive symptoms of depression: memory problems, reduced capacity of concentration, or to make even small decisions. Dark thoughts invade the mind of those who suffer from depression, so much as not to leave space for memory. This is the conclusion of some studies carried out by the Center for Brain Health at the University of Texas in Dallas. In the depressed subject, negative thoughts take a lot of space and tend to last longer. That's explained why maybe they have difficult to remember the commitments made or the last things happened. Furthermore, there is a slowdown of all cognitive functions, which negatively reflects on attention and ability to concentrate. Strong trend to blame oneself and self-assessment. The subject presents a low self-esteem and manifests a sense of renunciation towards himself, towards others, and towards the world. Phrases of the type, "I'm not worth anything," "I'm not good for nothing," are recurring. This dark present inside it can lead to recurrent and dangerous suicidal thoughts. Everyone would be better without me. I am just a weight. These are just some of the thoughts of those who suffer from depression. Death is seen as a release from the pain that keeps him a prisoner. According to OMS, there are about 1 million people with depressive disease who take their life every year. Affective symptoms of depression: loss of interest of hobbies and all those activities first considered pleasant and fun. The subject may feel a decrease in sexual desire due to the decrease in the level of sexual hormones. Motivational symptoms of depression: the person feels tired and without energy, even without having physical activity. Even the little gestures seem to require considerable effort, and it becomes more and more difficult to face the days. Notice a drop in school or work performance, until he gets to such a serious state that he does not even get out of bed to eat. Behavioral symptoms of depression: it can increase or decrease appetite. Some people may find comfort in food, while others have to strive to eat. Increase or decrease of sleep. Some may need to sleep for many hours, while others have problems with insomnia, wake frequently in the middle of the night, and may hard falling asleep. You can feel a marked agitation, a need to move continuously. On the contrary, some people complain of greater slowness in carrying out daily actions, speaking, and thinking. Some people have a psychomotor slowdown. The pace is slow and any action is difficult and requires a notable effort to be completed. Physical symptoms of depression: tachycardia, palpitations and headaches, muscle pains in the bones and joints. Often, the symptoms, even from the subject himself, are confused and mistaken for normal fatigue, stress, or nervosism. Often, those who suffer from it believe that their bad mood is caused by external factors, such as work, family, or sentimental problems. We all have high and low moments in our life, periods of happiness alternating to periods of sadness and melancholy. However, they are not confused with true depression, where the symptoms present all day, every day without stops. The depressed person thinks that he will never be happy and has no confidence in the future. If you are able to recognize yourself in these symptoms, it is good to contact a specialist in order to undertake a path that will help you to get out of this disorder as soon as possible.